All right, let's take you to the Eastern Cape now because Deputy Health Minister Dr. Sibongiseni Dhlomo and the Health MEC there, Nomakhosazana Meth, are today expected to launch the first Self-Care Wellness Vending Machine in South Africa. Now, this is all part of ongoing efforts to improve the adoption of various contraception methods in order to tackle teenage pregnancy in the country. The initiative aims to target girls and women of childbearing age, and there are hopes that it will also improve access to sexual reproductive health and HIV prevention services. For more on this, let's bring in our reporter, Fundiswa Mhlekude, who is with us for a sense of how this is all likely to unfold. And it's quite an innovative initiative, Fundiswa. I wonder if you can take us through exactly how it works.
Well, thank you very much, Ayanda. Yes, the Deputy Minister, Dr. Sibongiseni Dhlomo, is here with us, and he's going to be telling us how this vending machine works. And remember that the Eastern Cape is very rural, so there might be some complexities or maybe difficulties for the rural people to be able to work or operate this vending machine. And we have so many young children, school children, who are here today, who have come to make sure that they are told how this vending machine works. And we will also remember, Ayanda, that in the past 2-3 years we have seen lots of young teenagers getting pregnant, and we are told that by the health department that is almost 11,500 of those young girls between 10 and 13 years who fell pregnant. But let's speak to the minister now and let him tell us how this machine works. Thank you very much, Deputy Minister. Exactly how does this machine work?
This machine behind me is a first of its kind in our country, and here at King Sabata Dalindyebo Municipality under OR Tambo District is first of the 11 that we are going to have in the country. We want to see this as an add-on rather than replacing what we already have. We want to say the sexual and reproductive health rights and services available to at least the 15 to 24-year-old is a challenge for us in the country. We have a lot of unwanted pregnancies, illegal abortion, termination of pregnancies, and teenage pregnancy. But not only that, we also have a pregnancy younger than the age of teens, a 9-year-old, a 10-year-old falling pregnant. So it's a big challenge in the country. We are therefore getting responses from young people to say, but Dr. Dhlomo, your clinics are not some of them friendly to us. We have created what we call youth zones, where we have a young nurse friendly to young people, and in the country we've got 2,700 of those. So this installation of this facility is an add-on to say to a young person, you shall be able to have an app where you could actually be able to interact with a service provider, a nurse or a doctor or a pharmacist, and take history, and they could advise you based on the discussion to say, yes, I want to access NODET, I want to access trifecil, or I want to access condoms, male or female, I want to access sanitary pads. Then, having had that discussion, a young person will then come here and with a code given, be able to punch that code, and whatever has been requested through the service will then be dispensed from this machine.
Okay, maybe we should get closer to the machine, Minister, Deputy Minister, so that you can show us how it works, please.
Maybe my MEC should also join me. Now, what I'm saying, having received the code, which is actually going to be maybe 4, 5, 6, 7, enter. If that is a code I've given to me, whatever product that I've received, I've requested, whether it is that female condom, the male condom, the trifecil, or the sanitary pads, will then be dispensed here, and then I can take it very quietly, very privately, without going into any clinic, any hospital, to do it in my own space.
So how does one get the code? Do I have to go to a clinic or see a doctor first?
No. As we walk out of the university premises, walking out of the clinic of a house in the home, or just sitting in the sofa, you then interact on an app with whoever is a clinic. There's a caller that is, we are going to make a call to Seoul City, who are managing our products. that person is going to interact with you and say, I am sorry and so I'm Sibongiseni Dhlomo, age 24, I would like to get this and that. Through that discussion and through the advice that you are going to get, and the code will then be given to you, a code of a particular product that you have requested, and then you come with that code, then you punch it here, and what that code will be corresponding to whatever that you have requested, and that will then be dispensed here, then you take it home. So it's very safe. We are glad that MEC behind you has chosen that we come to this very busy spot, which is an N2 route to East London, to Durban, on this ultra city. So it's very helpful. We are saying to young people, if there is a way to decrease sexually transmitted infections, if there's a way to reduce unwanted and teenage pregnancy, if there's a way not to contract HIV/AIDS, and you are really having reluctance to visit our clinics, come here. Using that code, you then dispense whatever you need to have.
Let's talk about this seemingly pandemic of having 11,500 young girls, teenagers, or maybe not even teenagers, as you said, that maybe 9 to 13 years, young girls falling pregnant. It seems like it's a pandemic, Deputy Minister.
It is a pandemic, but when you look into it, when you look into the statistics in the country, you can always check from which communities would this come from. To some extent, other race groups are a bit protected, or whatever they do, they are protected from this. But it's mainly the African child that is really exposed to this teenage pregnancy, illegal abortions and all that. So I was actually saying, maybe let's even open up as parents. A lot of us would want to say, my 16-year-old girl is not doing anything, and therefore maybe Dr. Dhlomo bringing this facility is going to begin to make my daughter do it. They are already doing it. We are already seeing 9-year-old girls falling pregnant, and parents not aware. So we are saying, at the very private space, can they access this and really be able to say, I want to finish my matric before I fall pregnant. I want to finish matric before I become HIV positive. What do I do? This is but an add-on to such facilities in terms of what we already put in place.
Thank you very much, Deputy Minister. Maybe we should speak to the MEC, Ms. Nomakhosazana Meth. Maybe she will be able to tell us what are the areas in the OR Tambo region, as they are here today, that we have teenage pregnancy prevalent at. Thank you very much, MEC. Maybe you know, and I remember that during Christmas, we once did a story at one of the hospitals here in Mthatha, and you expressed concern that there was also a young girl who was a first mother.
Good morning to you and the viewers at home. You see, I'm all smiles. We are just appreciating the good work that is done by the Deputy Minister as the champion of young people's health. Because if you remember, he was here in 2022 during the June month to come and advocate and create awareness to our young people to stop going to illegal abortion centers and use our own CTOPs, which are legally managed by the Department of Health. We are worried, but at the same time, I think we shall defeat this pandemic. Because I call it a pandemic. To have children at the age of 9 years, it's worse now. There's one case that was reported of a 7-year-old who became pregnant. This matter is a social ill. It's a societal matter that needs all of us to hold hands to ensure that we defeat this issue of young children. It's not even called teenage pregnancy anymore. It's children pregnancy. But to have services like this at the convenience, at the fingertip of the young people, in particular in the rural spaces like OR Tambo, is quite very welcome. Because it's a call center and they are saying you will be asked some questions, and if they see that you are eligible to be assisted, they give you a code to go and get all what you are seeing here, free of charge, in your convenience without queuing anywhere. And we need that, in particular as Oartambo, where you get the majority of these numbers of our people our young people that are falling pregnant. I was sharing earlier on with the minister to say it looks like this issue of teenage pregnancy, it goes hand in a glove with poverty, because Oartambo and Fenzo are the most poor districts. But if you look across the province, you don't find these statistics so high in BCM and in the Nelson Mandela Metro. So we are saying to our people, here are the services. They must come, they get condoms, they get all these contraceptives and all the morning pills and all other, like the sanitary towels. But we're also happy to have young girls like these that are seated next to me who choose voluntarily to abstain because they are not ready for sexual activities. And we are happy and we are appreciating the work that is done by our national department, working with our partners, social partners, NGOs, and all the other institutions that are helping us to deal with this pandemic, so that we should make sure that our people, they go to school, they get to where they want to be in future without any disruption. Because majority of times, it's GBV that leads to seeing our young people falling pregnant. It's not out of consent, but unfortunately, even the conviction rate is disappointing, because they deliver in our facilities, but we don't see these people who are perpetrators getting arrested. But we are saying we shall defeat it.
MEC, the Deputy Minister was here. I'm not sure if it was last year or 2022. All right. And he said he first went to clinics, I'm not sure, and he talked about young girls who get turned away when they want to
Get the
abortion. Yes. And how are you going to make sure, what is your plan to make sure that you educate the healthcare workers not to turn these girls away, because I'm sure that it's their right if they want to have an abortion?
No, our government is doing its all. We are adding to the intervention of the youth zones. It talks about youth-friendly health services for adolescent children. So we've got youth zones in our facilities where they are able to go in a very confidential, private manner without intimidation of the adults, where we've got a nurse that is responsible at their age, so that they get to be comfortable to go there to get anything that they want that relates to sexual and reproductive health services. So we are saying we are looking at ensuring that our children, they know that they don't necessarily need to face their parents when they go to get the services. Unfortunately, Oartambo has got the highest number of the youth zones. About 105 of youth zones, you find them here in the Oartambo. A total of 513 in the entire province. So we know Oartambo is a district of highest numbers of everything. HIV, AIDS, teenage pregnancy, and all other issues. But in terms of service delivery also, we are doing our best to have the high numbers of services found in this district.
A Deputy Minister was saying that this is the first of its kind, and they had two here in the province. Where is the other machine?
You know, most are a district and province of first things to happen. Even you happened here as the first province, undetectable, untransmittable in terms of HIV/AIDS. So we are here to say to the country, these things can happen. So we are having this one here, and we are looking at putting the other one at Nyandeni, even though earlier on it was earmarked to another rural area here at KSD, but we are still to finalize exactly where to put that, because we want it to be at the rural areas where these young kids can access services.
Thank you very much, MEC Nomakhosazana Meth from the Department of Health here in the Eastern Cape. Deputy Minister was saying that you need to have an app, download the app so that you can be able to access all these services that they receive at this vending machine. Back to you in studio, Ayanda.
All right, Fundiswa and Mhlekude, thanks very much indeed for that. Fundiswa's live to us there from the Eastern Cape.